Hi everyone, it's me, I'm Mohammed from Iran. I want to talk about my story, first story of me in YouTube that I want to share with you, and unfortunately this story is about my disease. This is so-called uh, hairy cell leukemia, and I hope this kind of the video can help you, and if you have any question about this kind of the disease I can answer you. And just this, actually I was in every 6 months blood checkup in the hospital. So seven months ago, when I did it, my physician detected that I had a hairy cell leukemia, a kind of the rare blood cancer, and unfortunately it was so scary and fearful for me, but fortunately I tolerated it. And so after my physician detected that I had had a hairy cell leukemia, he told me you can choose a wait and watch procedure. So I did it, and I wait for about 7 months. And after doing a checkup, blood checkup in last week, my physician decided to start a treatment for me, and he said me, okay, you are well, physically you are well, but your CBC uh, checkup is not okay, and I advise you to start treatment. So uh, he prescribed me some drugs, and I I went to pharmacy and prepared my medication, and the main medication named cladribine. As you know, uh, this is the cladribine. I prepared this, and I talked with my physician, and he told me you can choose outpatient or inpatient for your treatment. I chose outpatient in the clinic of the hospital, and actually at yesterday I started my treatment in clinics. Okay, yesterday I went to clinic. At the first, I was so anxiety, and I was feared about the medication and treatment. And when I entered the clinics, I saw a lot of the people with a dangerous and serious disease. So it was so scary for me. But at the end of the treatment, I found out that's not so difficult, and it's simple and common. At the first, the nurses informed me about the medication and chemotherapy, something like that. Actually, they didn't inform me a lot about the medication, and in some situation, in some cases, they gave me incorrect information. For example, they told me that cladribine maybe cause a hair loss, and before the treatment I studied a lot about the cladribine. I knew that this kind of the medication uh, does not cause any hair loss, so just be relaxed. And about the another drugs and medicine that my physician prescribed me, I should say you. some drugs for the stomach, and this kind of the drugs avoid and prevent acid amount of the stomach. This kind of the drugs name, I think, mm, this pantoprazole. I took it in every morning, and it's so helpful. And other drugs that he prescribed me, antibiotics and antibacterial, and it's as you know, for the infection, and so important that you should take it. And this kind of the drugs named cotrexol adults, and this uh, fluconazole, uh, both of them for the infection. And at the end of the drugs, he gave me some drugs for avoid and prevent of the nausea and vomiting, and this kind of the drugs named dimetron 4, and all of them I think would be effective for me and effective for you. Okay, it was so long video, and I hope that would be helpful for you. If you have another question, I can help you. Have a good time.